Sure.
Great, thank you. Hi, for anyone who doesn't know me, I'm Will Sedley. I'm a doctor and researcher working on tinnitus, working in the sort of Newcastle and North East region. I don't actually come from an audiology or ENT background, so there may be many technical things relating to hearing aids and that sort of thing that I can't really shed much light on. But the other thing to point out is I'm by trade a neurologist, so I mainly see people with disorders of peripheral nerves, brain, spine, headaches, seizures, and that sort of thing. And my interest in tinnitus is rather unusual because this is something, as you'll probably know, is generally looked after in the medical profession by ENT surgeons and audiologists, etc., but is very neurological in its mechanisms, or thought to be. So the interest makes sense, but I'm in a rather interesting position where I have a lot of research experience in the area, but don't routinely see a significant caseload in the clinic of tinnitus patients. But if having me here is of any use in answering any questions either about the theory of tinnitus or just anything I've gleaned from here or there, then I'm very happy to come and meet you all. And for me, it's it's even more about learning about all of your experiences and inputs, etc. There was a specific question about hearing aids and difficulties relating to hyperacusis. I suppose to clarify a couple of terms before, recruitment that you'd said is from my point of view, the normal phenomenon by which, when your hearing is damaged, your brain turns up the gain or the volume, the amplification, so that you can hear normally. And hyperacusis is that kind of process, but where it goes too far the other way. So paradoxically, your hearing is damaged, making you actually more sensitive to things. I don't have anything particularly to add about hearing aid technology, digital hearing aids, other than knowing that people do struggle with this kind of thing. You're faced with a rock and a hard place situation where, on the one hand, you struggle to hear quiet and medium noises. Then you have a little window in the middle where they're amplified just enough to get them into that sweet spot, and then they get any louder than that, moderately loud, and they're too loud, and that's uncomfortable. And this is a major challenge faced by, I'm sure, various people in this room included, and many people worldwide. If we can crack this and really come up with the ultimate digital hearing aid, then this will be one of many breakthroughs waiting to happen.
I'd just like to reassure you, because I remember saying the last time I've had 2 bouts of hyperacusis, but they have disappeared. The first time I had it about 3 weeks, and my head was just like a picking up the power going to every machine. When I put the telly on, I couldn't listen to the telly for the power going through the wire and everything, and it was awful. And like I said, all the noise was terrible. And I had it for 3 weeks. I had done a long car journey down to the south, and when I got out of the car, I had this sensitive hearing, and it was awful. But just about 3 weeks later, it disappeared. And I had about, when it flared up not long ago, but that only lasted a week, and it's gone again, so it can't disappear. Just left me.
Hello, Doctor. The last time you were here, the last time I saw, you remember it here. Oh, sorry. Can you backtracking to something that you mentioned when you were giving a talk previously? You asked the group who would be interested in maybe in the future, after medical research, taking a tablet or having an injection. Well, I've thought about that since the time. Is it still up in the air about, because afterwards I thought, what size would the needle be? This is me. What size would the needle be? And where would they put the injection? Would it be in your ear? Or would it be in your arm? I thought about
Good
that
question,
a lot,
yeah.
honestly. That's why I'm asking. I'm pleased to see you.
Yes. Happy New Year. Okay, so I should emphasise. So what I've been doing is very much putting out feelers last time for the state people have found themselves in, or what they would would or would not consider doing, the help they might seek, the treatments they might look to for tinnitus. I was particularly interested in the early stages, the first days and weeks when things develop. And I suspect everybody, by virtue of being here, things have probably been going on for quite some time. And one thing in the field of tinnitus research and tinnitus medicine, and normally we see people where things have been going on for a very long time. And it's a bit of a contrast with the research world, where most treatments are tested on animals, usually rats, mice, or other rodents. Usually immediately after, or very, very soon after, giving the animals the tinnitus. And one major paradox is that things that seem to work in animals just never quite seem to work properly in humans. And one reason may be that actually some of the things given to animals are things that would only work if given early. Now, I'm not by any means proposing to give up on people who've already got tinnitus and it's established. But I'm personally keen to pursue two avenues. One of which is looking at early intervention. I suppose I was more getting at early stages there, because unfortunately the treatments, injections and tablets that people have tried in tinnitus once the tinnitus is established simply haven't worked, or haven't worked well enough that there's good evidence for them. So unfortunately, size of the needle, no matter how big a needle, how large a pill, whether it's into a vein or the ear, nothing's quite doing the trick, short of continuous infusions of anaesthetic agents, which there's one called lidocaine that does eliminate tinnitus, but only when the infusion is going in. There's no delivery. It's not something feasible to use as a long-term treatment. But I'm keen to work on strategies for treating tinnitus in the long term as well. That what ends up doing the trick may not be a medication. It may be an auditory or other sound-based therapy. I'm not too sure. So I suppose in terms of my own research, where I've recently been fortunate enough to get funding to have more research time, and I'm in the process of applying for more research money, but the sorts of things I'm looking to do now involve both trying to catch people at the acute stages of tinnitus, to map, as much as anything, map out the natural history of the disease. We don't even know really what proportion of people who have tinnitus for a few days or a few weeks go on to develop it long term, and to see if there's a window for intervention, but also, and perhaps more applicable to people here, keen to look at, particularly in the immediate future, sound-based therapies sound-based therapies that of a type that haven't yet been tried, to see if there's anything that can work to reduce the intensity of tinnitus even once it's established. So it's a little bit soon to be recruiting volunteers just now, but everybody here will be among the first to know when anything starts up, and you'll be pleased to know there are no needles, tablets, injections, or anything quite involved in that. We'll be looking at, in fact, something a lot less arduous than the last experiment, which I know some of you have participated in. But we'll see. We're talking about new things. There needs to be piloting, initial experiments, subsequent ones, and everything. But watch this space, because there'll be a bit more to come.
Do you know, a lot of deaf people, they say it's because their hairs are damaged in your ear that you get tinnitus. Well, are you doing any stem cell research into renewing the hairs in your ears?
Personally, no, but I know that there's a lot of stem cell research going on, and there are very large pots of money around the world being directed to the regeneration of lost hearing. And I do personally suspect, I think if we can truly repair the damage to the ear, and the evidence we have suggests that at least most tinnitus is caused by damage to the ear, and there's no good evidence actually that there is any tinnitus that's not caused by damage to the ear. It may well all be. I suspect it's the case, if you can truly restore the ear to normal, the tinnitus may well go. I'd be a little surprised, don't quote me on this, I'd be a little surprised if it didn't. I think we're some way off, so I think this will happen. I think there will, and in a sense, everything we're doing higher up in the brain about how aberrant signals from the ear are processed and everything, all of that might become a moot point if we can truly repair the ear. So that is the holy grail of tinnitus and hearing and hyperacusis treatment. I think if that can be fixed, potentially every aspect of it can. And that I suspect it's more a matter of when than if. However, there's nothing that I'm aware of immediately on the horizon. I think we're probably still some time away from that. Sorry, do you want me to...
Thank you. I think you found that levels of GABA in people with tinnitus were lower. Is it not just a simple matter of increasing the levels, of finding ways to do that?
Yes, sure, I will do. So the question relates to some of the most recent research I've conducted up here, which we have one and several kind volunteers, but it concerns the neurotransmitter GABA. It's one of the brain's very major chemicals. You have excitatory chemicals like glutamate and things that increase brain and nerve activity, and you have inhibitory chemicals, of which GABA, I won't spell out the name in full, I will, gamma-aminobutyric acid, but we call it GABA for short, that inhibits nerve activity and suppresses brain activity. And one thing, the key finding of this research really was that in the auditory cortex, the sort of higher hearing centre of people with tinnitus, there seems to be a deficiency of GABA, this inhibitory chemical, compared to matched controls with the same age, same degree of hearing loss, etc. So that it may well be the case that this is part of the mechanism of tinnitus. It's premature to say that's definitely the case. It could still be a consequence of the tinnitus or the conditions that lead to it. It's hard to be more certain. But on a more practical note, there has been interest in medications that act on GABA and either increase the amount of GABA or have an action like that of GABA. So some common examples are alcohol, benzodiazepines like diazepam, clonazepam, and certain anti-epileptic drugs like gabapentin, pregabalin. All of these work on the GABA system. There's been one epilepsy drug that was fantastically successful in animals that had just been given tinnitus called vigabatrin. Unfortunately, it's very toxic to humans and it causes permanent hearing damage in half of people who take it long term. It's never been tried in humans for that reason, and also for the fact, as I was alluding to, not everything that works in animals, in fact most things that work in animals don't neatly translate to humans. So I think somewhere in there may be merit to the GABA system, but certainly when we've looked at clonazepam that has an action like that, gabapentin, other things, there's no wild, fantastic benefit in tinnitus. There is a little bit of evidence for clonazepam, which is a fairly strong benzodiazepine that people would mainly take at night or twice a day. There is some evidence it might do some good. Not that it gets rid of tinnitus, that it might make it genuinely quieter. It has to be weighed against the effects like sedation, any other effects, because of course if you're essentially any medication that has an inhibitory effect, it inhibits all of your brain, not just the parts related to tinnitus. So the question for any treatment is, are these tinnitus-specific effects or any other benefits on any associated anxiety, sleep disturbance, are they enough to outweigh any side effects due to suppressing all the other bits of brain function that are functioning perfectly normally? So I think there is promise in this. Unfortunately, it's not proved such a straightforward matter as one might have hoped, really.
Could gabapentin actually give you tinnitus?
I'm not sure. It's not on my sort of radar as a list of highly likely culprit drugs, but with any medication we find that you have one or two very common side effects, a few uncommon ones, and then an endless lists of side effects that have been reported once or twice that it's difficult to link concretely to, or that are very unusual or idiosyncratic in the individual. So it's not like some of the antibiotics or withdrawal from benzodiazepines, things that we know definitely elicited. Is this from personal experience? You're wondering if it could have caused it. Unfortunately, this can be a very difficult situation because the only way you can know for sure is to have a huge trial with lots and lots of people randomized to either group. And in the real world, most people's lives are experiments with with an N of one individual, one thing that happened, one effect, and it can be extremely difficult knowing whether the two things are related. I spend a lot of my time as a doctor explaining to people that we simply don't know whether action X or thing X has caused consequence Y, and I'd struggle to give you settle any of the uncertainty that's there at the moment, I'm afraid.
What do you use to give the animals tinnitus?
Usually loud noises. That's the most commonly used things are loud noises. Either a short, extremely loud noise, sort of noise trauma, or noise overexposure, where it's above safe levels for a long period of time, where it sort of exhausts and wears out some of the hair cells in a certain frequency range. They're the most commonly used ones. People also use salicylate or aspirin in very high doses. That's something that's toxic to the cochlea, not in the doses that you or I might take for pains, headaches, heart disease prevention or anything, but in very high doses. The interesting thing is actually the effects these have on the brain in many regards are polar opposites from each other, depending on whether you use salicylate or aspirin to give them tinnitus or whether you use noises, which is very confusing because it means that probably a lot of these changes we're observing are not really the thing behind tinnitus, but are what we would call epiphenomena or consequences that are not directly relevant to the thing we're interested in. Is your follow-up question going to be, how do you know if an animal's got tinnitus? So there's a few ways you can do this, but the common element is they all relate to demonstrating the animal's ability to detect a gap in an ongoing tone at the frequency that you expect the tinnitus to include. And if the animal can detect a gap in the tone, then the theory is nothing is filling in the gap, i.e. there's no tinnitus, and if the animal can't detect the gap, that's because tinnitus is filling it in. This is a massive oversimplification, and there are various methods, some of which have come under fire lately because it's thought that actually there are other factors disrupting these gap detection things, because if you damage the hearing system, it's not just turning the volume dial down on what you can hear, you get other processing deficits, including the inability to hear gaps and make out the fine time structure of noise. So the best methods relate on actually teaching the animal to perform a certain behavior when it does and doesn't hear a tinnitus-like tone before you give it tinnitus, then you give it the tinnitus, or you apply whatever the insult is, and then you see how it behaves. They're very, very laborious and time-consuming, so everyone's switched to these automatic high-throughput methods, but they've been found to have a few flaws to them, so now these are needing to be revised, and it's left everyone with a little bit of uncertainty about exactly how valid some of the results from these experiments are, which may still be very valid, but may represent things other than tinnitus. So it's ingenious, inventive, the way people have done these. Unfortunate for the animals, but for a very good cause. But it's not straightforward, and the truly best way to do this is still being debated and still being refined.
Can I just is over here?
Thank you. I don't know if you've seen the television this morning. My sister-in-law rang before I left to come here, and there'd been something on the television this morning on ITV where they're putting a band around somebody's head with a motor fitted to it, and it's cured his tinnitus, so they reckon. You're on the door.
Can you send me that? I'd missed that. If it's a motor,
Well,
I have no idea what it is.
And I normally watch it every morning, but I never seen it this morning, and just like the thing.
This will be a very quick answer. I hadn't heard of it. I'd be very grateful if you could send along the link or anything. I can't think what it would be with a motor, but there are an ever-expanding number of tinnitus approaches in there. I'd like, as with all things, I'd like to see the full, formal group randomized control study, but any promising treatment is a good thing, and we never know which one of these avenues will provide a really meaningful benefit for people with tinnitus. So that's very interesting.
Has anybody read the letter in the Choir magazine about the man that went for a dip in the sea? And his ears filled with seawater, and he says, strangely enough, it took his tinnitus away for the 3 days, it took to clear out, and it was the first time he's had silence in years. So I think I'll be off for a dip in the sea.
Can I just inquire, was that the December?
Just the last one we've had.
Can I have the microphone, please? Because I can't hear without it.
Sorry, just a quick question. When you mentioned the Quiet magazine, was this the winter one? Because I haven't received my winter one yet.
I've just received it.
The winter one. Right, thank you. January, thank you very much.
No, I haven't seen that either. Oh, are you going to speak, or is somebody else going to
Go ahead. I hadn't seen it, so.
Just asking your view on gabapentin, what is that really? Because I mean, since the motor started, I've been on that, and I'm not sure whether, because when I first started, my tinnitus wasn't too bad. As time went on, it's got worse. And I've taken gabapentin. I'm not blaming gabapentin, by the way. I just wonder what your views are and what your views are as well.
Okay.
So what's your views on the gabapentin?
Look into. I'll make a note to look into this one.
Well, I've been on gabapentin and pregabalin as well. In years and years ago, when I was on probably my highest dose of gabapentin, that's when I started getting tinnitus, and it went away. It went away for a couple of years, and it came back with a vengeance. And I was on pregabalin when it came back. So I don't know if it's got anything to do with that. The same as I don't know whether, I had a tooth removed to try and get rid of tinnitus as well, because I had an abscess in my tooth and everything. So you can't narrow it down to one thing. Also as well, it could be because I've got chronic pain, and the chronic pain could have set the tinnitus off. So there's so many, I've got so many ideas where it could come from.
What doses were you on?
Oh, all sorts of different, because
It's 100, 300 and 600, isn't it?
it was quite a low dose, I suppose, but I had weight changes as well in the time and was on the wrong dose at some point. I was on too high of a dose or something, and then, but that's all in the past. I mean, this is years and years ago.
Is it okay if I leave the microphone between the two of you?
I'll give you a star.
Do you know any? Okay.
Yes, what's up that?
Well, I'll take this lull as an opportunity just to say my first piece of homework is clearly to research in depth the link between gabapentin and tinnitus and what is known about this. So it's an interesting question, because in fact the action of gabapentin is to perpetuate and increase the action of GABA, which we think may be deficient in tinnitus. So from immediate sort of basic effects and first principles, one might think if anything it would treat it, although I think the trials of gabapentin for tinnitus have not, if they've shown an effect, it's been a benefit, it's been very weak. But the nervous system and the brain and people's physiology are a very complicated thing, and sometimes very paradoxical effects can happen. So right, that's my first piece of homework. Any other?
There's just a letter in it. There's some information in the book about gabapentin, and it says they used it with lidocaine, and they found it to be quite good, but it does need a lot more investigation. But it does seem to have been beneficial, much higher than normal.